Miscarriage is a loss of a pregnancy that occurs before 20 weeks. And unfortunately, it occurs in about 15 to 20% of all pregnancies. When a miscarriage occurs repeatedly, we call this recurrent pregnancy loss. Here at Fertility Associates of Memphis, we have one of the 6 centers in the United States that studies, investigates, and performs clinical research and treatments for couples that suffer recurrent pregnancy loss. When a complete evaluation is performed, we can identify the cause of pregnancy loss in about 70% of all couples. The possible etiologies of recurrent pregnancy loss include genetic problems, which may be in either partner. It also includes problems with the uterus, which may be problems from birth called congenital uterine anomalies, or acquired problems such as fibroids, polyps, or scar tissue. There also can be a vast array of immunological problems that can affect the way that the mother's body receives and responds to the developing placenta. We also know that a number of hormonal factors impact the ability of the pregnancy to survive, and new studies have shown that a condition known as insulin resistance, along with thyroid disease and disorders of prolactin production, have been associated with recurrent miscarriage. A new and very interesting and developing area of medicine includes the thrombophilias, or blood clotting disorders, and it's thought that some of these may interfere with the ability of the mother's body to nurture and nourish the pregnancy as it develops by blocking the circulatory flow to the pregnancy. These can be identified and treated. And finally, certain infections in the uterine cavities, such as mycoplasma and ureaplasma, are moving to the forefront of causes of not only of early pregnancy loss, but mid-trimester losses. Once these tests are completed, a treatment plan is individualized for each couple, and once the pregnancy is initiated, the pregnancy is followed very closely until about 10 weeks, until a patient can be released back to her obstetrician or high-risk specialist for continuing pregnancy care. Not only do we see and treat patients at our clinic in Memphis, but we have an outstanding research program that continues to look into the causes of recurrent pregnancy loss. We've published over 70 peer-reviewed papers and presented at national and international meetings. It is our goal to find the problem that's causing your losses and provide the treatments that can allow you to have a successful delivery.